you to Secretary Sebelius for taking time out of her busy schedule to be here today. It really is a privilege to have her to talk a little bit about the Affordable Care Act and some of the things that are going on across the country and some of the things that Jersey City is doing specifically. Jersey City has tried to be more proactive than literally any city in the state of New Jersey and in this region as it relates to signing people up and getting the information out. Jersey City prides itself on being one of the most diverse communities in the state of New Jersey, with over 70 languages spoken in our public school system, and commonly known as the Golden Door to America, with Ellis Island here home in Jersey City. We have 10 counselors proactive out in the community signing up residents daily. We've partnered with all the universities in Jersey City. We've partnered with the Jersey City Medical Center. And we've tried our best to really be at the forefront of capitalizing on really historic legislation that is going to help millions upon millions of Americans, of New Jerseyans, and most importantly, Jersey City residents. So it's a privilege to have the Secretary here, and without further ado, I'll turn it over to Secretary Sebelius.
Well, I want to start by thanking Mayor Fulop. Mayors are the hardest working elected officials in the country. They're really where the rubber meets the road, and Mayor Fulop is doing what we hope mayors will do across the country, which is reaching out to his constituents, people who know him, trust him, and give them facts and information about their rights and benefits under the Affordable Care Act. The efforts here in Jersey City and across the state by the New Jersey Hospital Association to train veterans, and you're going to hear from Hilda in a minute, to help fellow Americans get covered, are a great example of what the President meant when he asked Americans to join him in making 2014 a year of action. Hiring veterans to reach out to folks who need health insurance is really a win-win situation. And I also want to congratulate the people of New Jersey for the great job hosting the Super Bowl. At least for the Seahawk fans, it was a great job. Now, if you think about the beginning of the playoffs, they started on January 4th, and the Super Bowl was about a month later on February 2nd. And I give you those dates only to point out that we really have twice that amount of time left to go in open enrollment for the new marketplaces. It's equivalent to the Super Bowl, the entire playoff season, the Pro Bowl, and the last month of regular season. So there's a lot of time for people to find out about affordable health care. You heard the President say last week that if you know someone who's uninsured, it's time to help them get covered. And it's never been easier or more affordable. Healthcare.gov, the website, is working very smoothly, up and running, and we're seeing thousands of people enroll every day. CuidadoDeSalud.gov is the Spanish version of the website, which is also working very smoothly. We have a toll-free call-in number at 1-800-318-2596, operating 24 hours a day, 7 days a week. Callers are available in both Spanish and English, and translation in up to 150 languages. And I was talking to the mayor and the city official in charge of health, talking to me about how diverse the population here in Jersey City is and across northern New Jersey. So getting people information in a language that they can understand is hugely important. People can enroll by mail, they can enroll directly with an issuer, agent, or broker, or they can come in person and talk to somebody like Hilda. Well, there may not be many people like Hilda, but someone who is trained like Hilda to do outreach and personal assistance. So the President has reminded us that part of being in America is that we share a belief in opportunity for all. The idea if you work hard and take responsibility, you can make it in America. But before the Affordable Care Act was passed, even if you worked hard, even if you took responsibility, way too many people were locked out or priced out of affordable health care. And because of the Affordable Care Act, it's a brand new day. Everyone, those uninsured and those with insurance, have new rights and benefits. Small business owners now have new tax credits and protections against spiking prices. Medicare solvency has improved. Years have been added to the Medicare Trust Fund, and seniors are actually saving money every year since the Affordable Care Act was passed. In New Jersey, there are lots of options for consumers to choose from. There are 29 qualified health plans to choose from. So in New Jersey, a family of 4 earning $50,000 a year can get covered for the entire family for as little as $131 a month with the financial assistance they're entitled to. A New Jersey family of 4 earning $25,000 can get covered for as little as $103 a month with financial assistance. Also in New Jersey, Medicaid is being expanded for the lower income workers here, and that all can be done through the website. So millions are getting covered from the first time. More than just under 35,000 people in New Jersey have already selected plans through the end of December, and 80% of those folks are receiving financial assistance. Overall, we have 9 million Americans who started the new year with new coverage, either eligible for Medicaid benefits or enrolled in the private marketplaces. And that adds to the 3 million young adults who already had been added to their parents' plan. But there's a lot more work to do. Here in northern New Jersey, there are about 580,000 people who are uninsured and eligible for benefits, and 1.9 million in the New York City area, both in New York and New Jersey. So a lot of outreach to do. So one of the most important actions we can take to secure more opportunity for Americans is to get covered, to reach out to friends and family members, to neighbors, to sons and daughters, to grandchildren, and remind them that this is a once-in-a-lifetime opportunity. There's quality, affordable health care that will be there when they need it. Now, I'm pleased today to also introduce you to Hilda DeMello. Hilda is a dedicated certified application counselor who's working one-on-one with individuals. She also is a veteran, and we want to thank her for not only her service to this country in the armed services, but her continued service to the country in making sure they know about affordable health insurance.
I was unemployed for about 18 months until this program came from, we got a grant from Robert Wood Johnson Hospital to certify veterans to help people get health insurance. I'm bilingual, I speak Spanish. We have people on our team that speak Creole, French, Swahili, and other languages. We have a lot of families that have come in that we've helped get health insurance that we're so happy because now they can take their child to get, go to the dentist or get some kind of health insurance and not worry about not being able to pay the bill. A lot of the veterans in this program were also unemployed, and now we're serving our communities. I'm the team leader for Team 3 in Middlesex County, and I also handle the Northeast area of New Jersey. And we have lots of clients, so we have the charity offices refer clients to our offices, and we try and do events at churches or various nonprofit organizations to help people get insured. Thank you.